So physicians meet with many patients in many contexts. Everything that they do, whether it's a diagnosis or a treatment, has to be documented. This is a tremendous burden on physicians.
And of course, when I speak to patients, I'm also very keen to get a point of connection with them, because that, in my experience, often relaxes patients, allows them to trust you, and then they can start telling their symptoms and their story about how their symptoms have affected them. And technology sometimes gets in the way. There's the computer on the desk, there's the typing away at your keyboard whilst the patient's talking to you.
So any tool, any capability like Solventum Fluency Direct that can help alleviate that time is much appreciated by organizations and physicians alike.
As a physician, I want to be able to just listen to the patient, and the technology comes to my help at the end of the consultation. And I would much rather spend my time with a patient teasing out important bits of the symptoms that may give me important clues as to the right treatment, rather than worrying about what I need to enter onto our electronic systems.
So what we try to help them with is minimizing that time. We call it creating time to care.
I'd like to have a consultation with a patient in which technology is almost out of the way. It's there in the background, and I will then, at the end, rely on the technology to document that for me. And so the patient doesn't see me distracted by tapping away on a keyboard or making handwritten notes.
If we can make the burden of documentation less for that physician, then they can be better at their jobs, they can be more satisfied in the work they do. And then our healthcare system inherently will be a little bit better off as well.
That's a very emotional time for patients. You're really trying to build an understanding of that patient, their symptoms and how it's affecting their life.